Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thank you so much for tuning in. I'm glad you are here. We're going to continue going into this wonderful series. We're now at episode 2, and we're talking about progesterone. It's something that is very, very dear to me, very important. If you remember from the first episode, I shared with you how this humble molecule changed the trajectory of my practice and took me from, this small, tiny little clinic into the space that I'm in now, and how it was responsible for truly it's the backbone of my practice. I, I, it is funny how many people ask me, like, how did you get where you are, or why is it what it is? And it's almost like they just don't believe me when I say it's progesterone. Is deep understanding of progesterone. And where it comes down to is that we are trained as physicians to view progesterone purely from the lens that it is a fertility medication purely centered around uterine lining. That's it. That's it. And that is a fraction, an important fraction, but it's still just a fraction of what progesterone does. And they miss everything. Miss everything. Think about this. As a woman, when you have progesterone irregularities, all the symptoms that go with that, yes, there's going to be heavier bleeding. There's going to be, dysregulated menstruation. There's going to be, painful periods. Those things are true. And those things are super important for us to focus on. But what about breast pain? What about insomnia? What about anxiety? What about depression? What about irritability? What about these things? What about not thinking clearly? What about sweating at night, not sleeping well because you're sweating at night? What about all these things? This is also progesterone. There's a role that progesterone plays in autoimmunity and immune function. There's a role that progesterone plays in neurobiology, not just as a GABA agonist, but also in myelinization of neurons. It's neurorestorative, neurogenerative, improves plasticity. It plays a significant role in memory, acquisition of memory, retention of memory. My goal in this is to really educate you why what I do works. Not because I want to feel validated. I'm good. I want you to feel validated. This is the center point. This is where I am. This is who I am and what I want to be in this moment with you. I want to give this to you so you have validation for why you're experiencing what you're experiencing. You have validation to request the kind of care that will bring you to that place that is going to find balance, where your provider is going to run the labs appropriate, where the provider is going to prescribe appropriate. That's what we're doing here. So let's get into it. It's fun. It's fun stuff. I made great notes, and it's so funny. So I was talking to Evelyn when I first started this. I prepped for these. I spent the whole week preparing for it. And a lot of the stuff I already have a deep understanding of it, but it's one thing to do it day to day in practice. It's another thing to take out what you know, put it on, in slides and make yourself notes. And when you do that, you almost will get a little curious, like, what about that? And you start to do more research, and kind of, in a way, by doing these presentations to you guys, it helps me become even more aware of new research, and it helps me kind of pull things together more tightly and word things even more clearly. So this does benefit me clinically. I've said this before, and I mean it. I grow as a clinician when I do these presentations with you. With that said, I spend all this time. I start working them on Thursday night. Thursday and Friday, I'm kind of formulating what I want to talk about. Saturday, I start to write it. Saturday, Sunday, I'm writing it, and I'm putting my citations in there so I can go back and make sure I'm staying consistent. And then Monday, Tuesday, I rehearse. And Wednesday, I'm filming. So every time Wednesday comes around to film, I forget everything. I think I don't remember anything. I just, it's one of those things that happens, I guess, and Evelyn said that earlier. But what was funny is because I just started mentioning to you what the purpose of this is and all these things. And that was actually my first slide. And that was just in my head. So it's natural. It's funny, 20 years in progesterone. I know I'm a man, but 20 years in progesterone, I'm working with it. It's just a part of me. It really is. It really is. Um, I want you to know progesterone is a brain hormone. I want you to start thinking of it that way. I want to keep that in your mind that it is a brain hormone, okay? See, progesterone is a brain hormone, and I'm trying to use terminology that is accessible to you as a patient, as the woman who's watching this. But I also want to make sure I give you the precise words. So that way, if you were speaking to a clinician, sometimes if you don't use the precise words, they become very picky and they use that to dismiss you. So I'm going to be very precise right now. Progesterone is a neurosteroid precursor. When your body has enough progesterone, you're generating it from your own ovaries during the second half of your cycle. It crosses the blood-brain barrier. It gets converted to allopregnanolone. That has a direct impact on your central nervous system. It plays a role with sleep, as I mentioned, anxiety, depression, insomnia, all of these things goes back to the benefit of progesterone and what it does for you as a woman. And where it's problematic is that in your late 30s to early 40s, you start seeing a decline in it. And as that declines during those years, you start to see the stability that progesterone was providing for you. Its metabolite, allopregnanolone, doing all that good work, that stability was giving you, starts to be less reliable. You have months without it. Things start to go sideways. This is where progesterone shines. One of the ways I think that I had success with building my patient base and having patients stay with me all these years is because I don't see them as women as broken. You know, I don't, I view them through the lens of where is the balance lost and how I restore the balance. One of the reasons why I have the patient base I do and the trust that I have with these women is because I was dedicated to understanding how progesterone impacted them. I didn't just blame it on them. I didn't just say, well, that's a part of life, or, I didn't blame something outside of my wheelhouse. I looked in my wheelhouse to see what it was that I could do to help that woman. And I found that these women are not broken. These women were going through a radical shift in neurobiology, which is what I believe menopause is in many ways. It's physical, but it's also neurobiology here to get into that. It's reproductive and physical, of course, but there's the neurobiology component that I think is very important for us to be aware of because that's the center point for me. That's something that I find being essential. And when you sit down with a woman and you see her through that lens and you work to validate her that way and you work hard at it, they see that. Today, I want to be precise and I want to drill down and give you a deep understanding of the neurobiology of progesterone. There are some of you out there that have been messaging me with great regularity about how progesterone, when they take it, they have absolutely horrible experiences. And then many of you have had the opposite. That's called reverse responding. I want you to know that I'm not going to focus on that in this episode. That's going to be coming in another episode. This is me trying to lay the foundation. And I want you to know, as I lay this foundation down, I am not forgetting you. I'm not forgetting the women who, when they take progesterone, they don't sleep. They take progesterone, they have anxiety. They take progesterone, it is completely an uncomfortable experience. I'm not forgetting you. What I want to do is lay down the basic biochemistry and neurobiology, in this sense. And I want to set that so that way I can explain more clearly in a future episode how it went wrong and how to correct that. So right now, I'm going to just lay down a scaffolding that's really important to do a good job with it. Progesterone's neurobiology is well documented and well understood. This is not something that's new. You have all of these receptors throughout the mind, and specifically the amygdala to the hippocampus to the prefrontal cortex. Those are three areas we're going to discuss quite a bit today. Today, I want to deep dive into progesterone as a neurosteroid, how it impacts amygdala, hippocampus, and prefrontal cortex. These are three important parts of the brain that are being affected by progesterone, that are essential. Progesterone's role here is essential for these to work correctly. And these are big things to discuss. These are terms you probably never use. I hope you don't. These are weird things to talk about in your daily life. It's like my amygdala is this way today. It's kind of a strange thing to say, but these are not normal terms you use. So they are foreign. I promise to work very hard at being precise in my use of these terms. And my desire is not to have you feel confused, but I want you to own these terms and own what they mean. The spark of emotion comes from the amygdala, and she is triggered in situations, and that emotion comes up, that spark comes forward, and it pushes forward into the hippocampus. The hippocampus is where it finds context. This reminds me of when I was in the hospital, I got bad news. This feels like what it felt like the time my child forgot their homework to school. This feels like whatever context, whatever memory. And that's what the hippocampus adds to that amygdala. And then it pushes into the frontal cortex, the prefrontal cortex, where you choose to act upon it. So these three areas are strongly influenced by progesterone through its conversion to allopregnanolone. Progesterone converts to allopregnanolone. Allopregnanolone binds to these three regions of the brain with high specificity. And it is a very important part of how they fire. When you get an email from your boss and everything is working well, you look at the email, you try and understand what it's coming from. You make your decisions around that. It's good. Maybe it's a critique. You're like, all right, I can see that. I can fix this. This is not bad. That's a normal firing amygdala, hippocampus, prefrontal cortex. You get an email from your boss and you go straight to anxiety and fear and terror. That's when the amygdala, hippocampus, and prefrontal cortex have lost their buffering, and you're just running with it. And you don't feel a choice is available to you. You just react. This is when you snap instead of feeling you have the ability to make the choice. This is when you feel out of control, especially when it's something that you have mastery over. And this is why women feel like they're falling apart. Because that pathway, the amygdala, hippocampus, prefrontal cortex, that pathway. Let me first say this. There are times it should run fast. There are times when you need to have an immediate, like, oh my God, and react and jump. That's okay to do sometimes. But when it's everything, when it becomes more and more common, you feel like you're losing control. You feel like you're failing yourself. You can see it as an act of willpower that you're supposed to use to bring back your brain and not overreact to things. And you feel like a failure when you don't. You are not a failure. You're a human being with a body and a brain, a beautiful brain. And when you are missing that essential ingredient, how can we expect it to fire correctly? That's not fair. That's not fair. What causes this loss of progesterone, we know it's when a woman is perimenopausal. And let me step back and remind you of that, how that works. The first half of your cycle, your ovaries have these follicles where there's the egg in there, and those follicles generate estrogen. And estrogen is stimulating all those parts of you associated with fertility, breast, uterus, cervix, breast, all the tissues being stimulated to grow. That's associated with conceiving. And there's also going to be the other benefits of estrogen to neurotransmitter synthesis, because it is good for that, for memory and cognitive, for hair, for cholesterol. There's all the good things, and bone density, all the good things estrogen does, numerous things. Then around day 12, 13 is when your body gets a signal to ovulate. And that's when the follicle collapses and converts into something called the corpus luteum. And the corpus luteum releases progesterone. Anywhere, ideally 5 to 20 nanograms per milliliter. Now, That progesterone is what we're talking about because that's what crosses the blood-brain barrier, does the work. Now, your adrenal gland will make a little progesterone as well, but not that much. This is really going to be all relying we all rely on that coming directly from your ovaries. Okay. So when a woman enters in the perimenopausal state, you're going to have diminished returns from your ovaries and your progesterone levels are going to go down. And now you're going to find yourself anywhere from 0 to 22 in the progesterone. That is a huge variable for something that plays such a big role in the balance of your brain circuitry and how you process stress and strain. So perimenopausal women are already under risk because of these anovulatory cycles where they don't ovulate, they don't make progesterone. What else risks? What else puts this in risk? When the woman comes in and she's under chronic stress. Chronic stress also plays a role in diminishing progesterone. It can inhibit ovulation, but it can also convert the progesterone you have into cortisol instead. So women under stress, women who are perimenopausal under stress are the ones who have worse cases of this. And this is when you feel like you're under stress and you're 40 years old, it's like you lose trust in yourself. And I've heard this. I want you to know I'm repeating the things that have been told to me for 20 years now, where women feel like they just don't trust themselves to react like they should. They don't. And this is like a beautiful part of your life where you should feel that experience is kicking in and you feel like you figured it out a little bit in life and you kind of know where you're going. And that's when all of a sudden you get, kicked out from underneath you, your legs kicked out from underneath you and it's gone. It's gone. So part of me doing this also is I want to try and help you restore self-trust. Can you take a minute and just feel what I'm saying for a minute, right? Why wouldn't I be successful at this? Why wouldn't I have patients come to see me? If what I'm saying is true and the research stands by my side and 20 years of practice stands by my side, why wouldn't I have a following of patients? And it's not me, I hope by watching my podcast, you realize I'm not a high ego dude. I don't really like praise too much. I'm just me, I'm here for the feels. I love what I do. But I want you to know it's such a simple thing. And all I'm speaking to right now is care. Like care. Do you hear? I hope you hear it coming from me. Because that's all I have. Deep care. And when you see a woman have self-trust restored because she feels like she's not out of control, she understands her biology. When you help her in this area, how do you not love what you do? How do you not do this for a living? You always seek it out. You're like, well, how else can I be helpful? How else can I be better? It's that awesome. So, perimenopause, as I mentioned, that's going to be a period of time for many women where they feel this, chaos and ovulation is inconsistent. Like I mentioned, you'll see estrogen levels spiking high and low. You'll see irregularities there. You also see in your 40s, a lot of times life changes. Kids are getting older. What you're doing is different. Some of us have second thoughts about what we want to do for a living or what our purposes are in life. The 40s are not always easy. So you have the stress of that progesterone being low because you're in the perimenopausal state. You have the stress of estrogen fluctuating, which is also another biological thing that occurs that is stressful, for the symptoms it generates, breast pain, excessive estrogen can generate anxiety, et cetera. There's more to it, but I don't want to lose what I'm talking about here with progesterone, so I'm sticking with progesterone. But just know there's more with estrogen. I have an episode out on it. I'll do more in the future too. Okay. So progesterone during this time help stabilize these women because that perimenopausal state is not just chaotic because of the anovulation and the diminished reserves associated with that perimenopausal state in that time of your life, but it's also chronologically, there's a lot going on that also plays a role. So there's a lot of chaos in a lot of these women with this, and granting them that lifeline, that moment of stability that we can do with progesterone is gold. I want to circle back to one key thing. Is that every major part of the brain wrapped around symptoms that women have in perimenopause has progesterone receptors or allopregnanolone receptors. We know the amygdala, hippocampus, prefrontal cortex, but also the hypothalamus and the cerebellum. All these parts of your brain have receptors that are influenced by progesterone, and then its metabolite, allopregnanolone. And when you don't have that, these major areas of the brain are off. I mean, think of the cerebellum as balance, hand-eye coordination. This is serious, and hypothalamus is the precursor to the pituitary. That's what controls the pituitary. This is about regulation of all your hormones. There's a lot up there that progesterone is binding to through its downstream metabolite, allopregnanolone. So far, I've described allopregnanolone in terms of almost like a volume knob. When you have things come through your life, you have a stressful situation, you have, kids in the back of the car yelling, and, you have a number of things happening, your dog going through the trash, which my dogs do sometimes. You have all these things happen without progesterone, that volume knob being adjusted, it just all goes to volume 10. And you have that severe stress because allopregnanolone binds to those receptors in the brain associated with anxiety, the GABA receptors. So the gamma aminobutyric acid receptors, allopregnanolone truly shines in that part of the brain and provides it with context. It helps slow things down so you can see the decisions that you're making in real time without having a decision made from knee-jerk. You can understand the situation where you are and be able to make decisions to de-escalate it, like the kids yelling. With the dog, instead of getting really upset, you're like, all right, I clean this up, and now I have to make sure the trash is taken out so they don't have it around them. Like, these are the processes. You want to be logical, but when your emotions are not letting you, allopregnanolone low, you just react real hard. So allopregnanolone is such an important component. I want to make sure I'm being very precise with it. I want to bring up another important part here, not just emotional, but I want to talk a little bit about the cognitive shifts that happen around perimenopause that affects women, where they start to think they're losing their mind. And especially if you have a family history of dementia, or anybody in your family has cognitive decline, there's a lot of worry and of fear that I see in the patients that I see, like, is this happening to me? And you'll see that where they have, they can't find the right word, or, they're fragmented attention where they can't seem to focus where they're supposed to be, memory lapse. These things, when they occur to you, they kind of can be alarming and frightening. And of course, I do full workups. When you're out there looking for a doctor, don't let the doctor always treat you with the one thing they do. That drives me crazy. It's like go to chiropractor with a rash and they want to adjust your back. It's like, that's not what this is. You know what I mean? That happened to me once. I went to a chiropractor, and I'm not anti-chiropractor. My brother's a chiropractor. But with that said, if I have a rash, there's no chiropractic adjustment that's going to fix a rash. For the love of Pete, I'm not going to sit here and tell you that progesterone cures everything on earth. It doesn't. You want your doctor, when you come in with a symptom, to do differential diagnosis and have their brain open and on. So I want you to know, when I say progesterone plays a role in cognitive function as we age, know that I'm not pinning all cognitive dysfunction in women on low progesterone. I'm also not pinning all emotional destabilization on progesterone deficits either. There are times when the woman will come into clinic and she has anxiety, and we get the progesterone perfect and she still has anxiety. My work is not done. This is not a cure for everything. It is a cure for its own deficit, okay? Progesterone works well when it's the cause of the problem. And our goal is to always find the cause of the problem. Always. So when women have that cognitive change that happens, I do a full workup. I want to understand her completely. I want to understand the blood sugar. I look at B12. That does happen. I want to look at, blood sugar. I want to look at all those things that maybe play. Thyroid plays a role with cognitive and recall and those things. But we always do look at progesterone as well, because progesterone plays a role. And I want to tell you a funny story that my wife and I talk about a lot. And there have been so many babies born in practice. I've had 3 doctors have babies within just the past 3 years. And guess what? One more is pregnant. She's about to have her baby too. So I'm so proud. I love kids, period. I think kids are awesome. And the only reason why I couldn't be a pediatrician is because I have too much emotional, I don't have the emotional, I'm not made, I can't, I love kids. Like, some people are blessed with the ability to become a doctor to children. Those are unique human beings. I have such an admiration for them. Anyway, when a woman is pregnant, progesterone goes from normal, 5 to 20, 22 maybe, nanograms per milliliter, all the way up to like a couple hundred, like 200, 240. Depends on the lab company you're using, and depends on their pregnancy. Sometimes they don't go as high, but it gets up there. It magnified, goes way up. When that happens and you give birth, what's really funny, high levels of progesterone affects memory and causes you to lose some memory. Progesterone modulates your ability to remember things. And this is why some people forget what birth was like, and they forget childbirth enough in order to want to have another kid. Like, this is a topic they talk about at work with the women I work with. And it's like, I had amnesia, what it was like, And it's just the body's way of protecting you from certain memories. Progesterone does that. It's beautiful. But when it's low, it also plays a role with cognitive, your ability to consolidate memories. So we want to think of progesterone not just for your emotional stability, but also for cognitive performance. What else? Progesterone. This is a fascinating one. I saw it's a randomized study done, randomized control study done up in Canada, where they gave women 300 milligrams of progesterone, perimenopausal women 300 milligrams of progesterone, or placebo. The women who did the 300, and they wanted to see if it stopped them from having hot flashes and sweating at night. And for hot flashes, it totally failed. Nothing, no benefit. But for night sweats, it worked. Progesterone improved quality of sleep, it improved depth of sleep, and reduced perceived hot flashes and night sweats. It reduced perceived night sweats. Didn't affect hot flashes, but night sweats it truly did. So there's a benefit there as well. So when I prescribe progesterone, some of my patients cannot take estrogen. Progesterone will help with those night sweats for them. There's other things I can do with the hot flashes, but that's something I could be very helpful with, using progesterone in that situation, in those cases. Again, always in coordination and hand in hand with an oncology team if I'm dealing with a breast cancer survivor, always. But this is one of the benefits. It's not just mood, okay? Another thing I want to be very clear with, and I've said it numerous times, but it bears repeating, there are different kinds of progesterones available out there on the market. There's the progesterone that is natural to you, and that is progesterone. Then there's synthetic progestins, and it's like almost like it's too cute by half. They're trying to they use a similar name, and this is a problem with a lot of hormones. They come up with a weird, funny name that sounds just like progesterone, so we call it progestin. Medroxyprogesterone acetate, that's also synthetic. That's actually one of the worst synthetics. These synthetic versions of progesterone do not go into your brain and have the same positive impact. They just don't. They don't. And so I want you to know, when I say progesterone, I mean the kind you make and the bioidentical kind that I prescribe. I do not mean I do not mean medroxyprogesterone acetate or any progestin, any synthetic progesterone. I mean oral micronized progesterone. That is what we prescribe in practice effectively. In my next episodes, I want to get in to reverse responding, absolutely, where women take progesterone and feel like they're going to lose their minds. But I also want to talk about how trauma impacts these pathways for women. Women have a long history of trauma in their lives. When progesterone is removed, they feel it more. They feel it much more, because those pathways, you think of it as like a highway, and with heavy traffic going along with the amygdala, hippocampus to the prefrontal cortex. It's just high traffic with that trauma history, heavy trucks over and over and over again. And progesterone was the thing that supported that pathway and prevented it from kind of collapsing and breaking down. And then when you move progesterone to perimenopausal state, women who have a history of trauma really feel it more. They feel it more. So I want to get into that a little bit and why that's important to be aware of it. Because at the end of the day, using progesterone in these settings, when appropriate, you can change someone's life. It's such a humble molecule. It's not patented. It's naturally occurring. It's the same thing your body makes. It is such a gift that has been overlooked for too long for you women. And I want you to know I am so dedicated to you with this. I'm going to do this podcast until I'm done because you deserve many people to stand up for you and stand up with you and support you during this time. We've gone too long with women not being regarded well. We've gone too long for women feeling ashamed of something they should not feel ashamed of. We've gone too far. It's time to stop. And it's time to bring clarity and light to this and create a path forward where women are not stigmatized because their perimenopausal state causes them to have mood irregularity and instability. And women deserve deep care, caring care around this. And I'm so dedicated to do this by your side. And I will keep doing this till the end. To the degree I'm doing a good job, I'm good. I'm happy. I'm thankful. Like the episode. I'll get the feedback that way. That's one of them. Another one is, comment. If I'm missing the point with you guys, if I'm not doing a good job with you, I need to know. I want to know because the only purpose I have in this is being of service. To the degree it's of service, I'm doing good. Share it with someone this might help them. You all know that friend who breaks during this time in her life. You all know that woman that breaks around the time of her cycle. And you all wonder, what happened? How did that happen? We're here for her and for you. So share with her. I hope this would help. All right. Next episode, we'll get into reverse responding. And I'll see if I can do in the same episode talking about trauma and the role of trauma in progesterone and how women who have a history of trauma like PTSD or complex PTSD and PTSD will feel it more acutely when their progesterone is gone. All right. Thank you so much. And I'll see you at the next episode.